Okay, good evening, ladies and gentlemen. I think the clock's about 3 or 4 minutes slow, we believe. So we'll commence. Our clocks have gone past 7. So thank you all for coming along this evening. In terms of apologies, don't believe I had any other. No, Pauline Heather Simons is going to join us online. And she said she might be a bit late in doing so. I believe that Morag Malvern is also going to join us, but said she might be a bit late. So those are those that we're expecting. Takes care of everyone, actually, in the committee. So it might be just worth introductions again for all the team online. We've got Graham Howe, the executive member, but Helen, would you like to introduce the people that are online and which items they're going to speak to, please? Thank you.
Yes, good evening, everybody. We've got a rich and varied agenda for you this evening. So looking through the agenda, we've got Sudeshna and Deepak with us, who will take us through the performance report. We've got Matthew with us, who will take us through the harm outside the home strategy. We've got Hayley and Adam with us on the specific issues around accommodation. And Gillian is with us in terms of the school-related agenda items. I'm sorry, I appear to be having some technical issues, but I will get my camera sorted. But that's the agenda this evening. Thank you.
Okay, great. Thanks very much. So moving on then with the agenda, item 40, the minutes of the previous meeting. Any amendments to those minutes? Any questions or comments on the minutes? Andrew?
Yes, thank you, Chair. It's just one question, update if possible, and that's item 35, the review of the home to school transport processes. I'm just wondering whether, now that school offers have gone out for the next academic year, if it's possible to have some brief comment, about how officers believe this is going now, specifically the school transport, so for the new cohort.
Is anyone online able to cover that item, please?
Chair, perhaps if I come on briefly, we're obviously sorting through the offers for the next academic year. Parents had to respond by last Tuesday, the 15th of March, and we're obviously working through the implications of all of this. So I'm afraid I'm not able to give a more detailed update than that, but I'm sure we can provide a written response if need be, if that would be helpful.
Yeah, if and when that's available, I think it would be reassuring. So thank you very much.
Thank you.
Great, thanks. So can I take a show of hands as to accepting these minutes as a true and accurate record of the meeting? Okay, that's unanimous. Thank you. So I'll sign those minutes as a record. Okay, the next item is public question time, and with the period set aside, we have one public question, which was in your agenda. Mr. Williams, I don't think is with us. He wasn't planning to be with us this evening, I don't think. So he will receive a written answer from us to his question. We'll move on to 43 members' question time. Do we have any member questions? There are no member questions. So we'll move then on to item 44, which is the Children's Services Performance Indicators, pages 15 to 26. who is planning to introduce this. Is that you, suggestion? You're on mute. We can't hear you at the moment. Yep, we can hear you now.
Yeah, hi, I'm Stishna from Intelligence and Impact Services. I'll just share the report, but I hope that because this has been shared, everybody have the opportunity to have a look at the indicators and the dashboards. If I share my screen. Please let me know you can see the screen. I can't.
Yes, we can see the screen. Thank you.
Thank you. So the first item is about the children and young people in education and health and care plans. Any questions about any of the figures or the narrative in the report?
Andrew, please.
Yes, thank you. I note that in Q3 of 21-22, it was roughly 37% of the young people with EHCPs were placed outside of the borough. And in percentage terms, that figure seems to be fairly consistent. Now, one of the reasons, why this is happening is identified in the narrative. It says that one of the contributing factors is that we don't have an FE college, so that most of the post-16 cohort are placed in out-of-borough provisions, and I understand that. I'm just wondering, two things really. What are some of the other reasons, common reasons, why this is happening? And what are the practical implications of this, including perhaps costs for the borough, impacts on the welfare, of the young people as well? Thank you.
Thank you for your question. In terms of the cost, I think I have to come back to you on that. And the common reasons which you have asked, yes, we do not have a FE college in Wokingham, and hence most of our post cohort are placed out of borough. But again, there are some complex special education needs, which also is the reason why they are placed out of the borough. But again, I can come back to you in a written report after the meeting, if that's okay.
Yes, that's fine. Thank you.
Okay. If I go to...
Sorry, we've got a couple more questions here.
Okay.
Okay.
Right.
Prue, please.
My question is really about the number of EHCPs is going up, and the EHCPs issued within 20 weeks of the referral has gone down. And my worry is capacity. Is there a capacity issue in dealing with this number of EHCPs? Do we have to do anything about it, or is it going to even out again and be okay?
Yes, this is something we need to mention, that the children's services workforce has been hit very hard due to COVID. And I think this is the worst time we were being hit in when we compare the previous waves. So it started from mid-November, and in December, I mean, there were more COVID sickness, and which really impacted on the service capacity. And as you can see in the narrative, when we send the information out to the partners to receive for the assessments, we haven't received that in time. So again, it can happen. The other service, other partners were experiencing the same service capacity, but this was one of the main thing, if you can see in the narrative here, that we were not receiving information by 12 weeks, which we were supposed to receive. Hence, we couldn't complete those or issue those final EHCPs within the 20 weeks.
Okay.
Chair, I'm wondering if I could just come in and just to reassure the committee that we do have a very proactive SEND IIP board, which is keeping a very significant oversight of the demand pressures that we've got in relation to EHCPs. This group is also overseeing some of the capacity challenges that we have around school places in terms of SEND provision. I'm sure we could provide a more detailed update at a future meeting. Thank you.
Okay, thank you. Rebecca, please.
I think you may have answered this question for me. I'm not quite sure if I quite got what you were saying, but my question again was about the EHCPs and the time that you're getting delays. And you actually mentioned that it's because you're not receiving them in a timely fashion from your partners. So what does that really mean, and what can you do about that to speed it up? Is there anything you can do?
This is something I think I have to go back to the services, but I know, as Helen was mentioning, in the board we discussed this and there's a plan around it. But this quarter 3, every partners like health, the information received from health, from schools, there have been few delays in receiving for the information, and it was mostly due to COVID sickness. But as Helen was mentioning, the service have a plan to really cope with this demand and have a plan forward to deal with this issue. But if you require more, we can provide you the narrative after the meeting.
Okay, and one further questions. And
yes, please. One thing is, there's the section on early help. I'm not sure if I've come across that before. I just wondered if it could be explained what sort of help that is, and who asked for it, and who are the typical recipients, please.
Yeah, thank you for the question. Deepak, would you come in, please?
Yeah, sorry, what was the question again?
Sorry, Anne, you need to use the microphone.
Sorry, never get used to this. As regards early help, what sort of help is that? Who asks for it, and who are the typical recipients?
Normally it's the parents who would ask for it, or partnering agencies who say they need some extra support but don't want to go. There's no child protection concern, so it's a voluntary basis.
Oh, right, thanks. And is it sort of educational support, or is it outside?
No, it's practical support that their family require.
Oh, right. Could you give an example, just so I've got an idea? Sort of.
Say young person's not going to school, need some help going to school, or some behavioural issues that the parents cannot cope with, and just need that kind of advice in terms of how to kind of put some boundaries in place. Oh,
right. Okay, thank you. I've got another couple of questions here. On section Children's Social Care Front Door, so it's talking about referrals, timeliness of assessments completed within 45 working days increased this quarter. I was wondering, how long does it take to assess 100% of referrals?
Well, that would depend on the complexity of the case and how quickly partnering agencies respond and whether the family are engaging with the assessment process. But we strive towards 100%, at least 80% if possible.
Right, I see. So 80% is a sort of working.
Yes, kind of guidance we have, yeah.
All right, okay.
Can I just add to the previous question you mentioned, just to direct you towards the Wokingham's website? There is actually a whole page that might be worth looking at about early help that describes the offer. So it might be worth just looking at that to provide a context to what that sort of service offers.
All right, okay. Thanks very much. Thank you. And then there's the background to the Children's Social Care Front Door. I just wondered, because you're noting here contacts which become referrals. I just wondered, is there any information about the proportion of contacts which progressed to referrals?
Yes, we do have figures for that, how many contacts are received and how many becomes a referral. It is broken down.
Oh, right.
And we're sorry to cut you, and we monitor that on a regular basis.
Oh, right. And I mean, I presume, is there a sort of an objective? Do you have objective standards for sort of how to convert a contact to a referral?
Yeah, it depends on the threshold, whether it meets the threshold for child protection and any child in need guidance, basically.
Oh, right. Okay.
But just to clarify, there's no target number of contacts we would want to convert. We monitor it and to establish that we're receiving the correct types of contact or information that's coming in.
Right. Okay. Thank you. Oh. Right. Okay. Yes. Okay. That's fine. Thanks very much then.
Thanks, Rebecca.
On page 25, dashboard item 8, the Children's Services Workforce. You state about the increase in agency staff and agency workers across the workforce. Now, obviously, there will be cost implications with that, as you know, from nursing all these years ago, knowing about the cost of agency staff, but also the way it affects the actual running of the workforce. Have you found there's been any particular impact from having a reliance on that?
We try and separate the difference between stability and permanence when looking at workforce. So often there's an assumption that interim or agency staff don't bring permanence, but we try and make it clear the difference between stability and permanence. I would say the whole profession has a challenge with recruiting permanent workforce, and a number of local authorities in this region have similar or higher percentage, and we have starting to see an increase in that. Some of that is filling vacancies, some of it is covering sickness, which is a consequence of the current or the recent pandemic that we're exiting at the moment. It is an area that we're focusing on. We have a particular focus that looks at that, reducing that because of the spend and also wanting to move to that permanence from the stability. And we've recently signed up with the local authorities across the southeast region a memorandum of cooperation in relation to how we employ interim workers to try and prevent that workers moving around or leaving a permanent role to move to a local authority as an interim post.
I think what I wanted to know, but does it have an impact on the service for you having different staff, or do they stay for a long period of time?
So we've had a number of locums who've been with us for a long period of time. It's not tend to be a throughput role, sort of number of weeks or months. It tends to be long term. But obviously, what we want to do to address the permanence and address the cost element is to recruit a permanent workforce. So that's what we're focusing on. But when workers come as an interim, filling an interim role, they're often coming with a vast range of experience into that role.
Excuse me, Chair, would it be possible to go through each of these dashboards in turn in the order in which they're listed here? Because at the moment we're jumping around a little bit.
We are jumping around a bit, yeah. Yes. It probably would be helpful to do that. I guess we started doing that and then we drifted. So are we all finished with item 1? Yep. Item 2, any points on item 2? Any additional points? No. Item 3, any points on item 3? Prove, please.
Put my microphone on. Adam, it was kind of raised before, but it hasn't quite been answered. It's a paragraph on page 19 where it says what action is the service taken. And it says you're reviewing the number of contacts that have not progressed to assessment to ensure thresholds are being applied consistently. I find that vaguely worrying. I'm hoping that somebody will give me some reassurance that it's which way round it is. Are we under progressing people to assessment and missing people, or are we doing it the other way around? I'd be a bit worried. Do we know if we're likely to have missed people, or are we reviewing that?
Your mic's up.
Yeah, just realised that. Thanks. I would say, as you highlight, it's a risk both ways in terms of over assessing families that don't require assessments and then ones that maybe. And I would say that's the application of the thresholds. And what we do is we do undertake audits or reviews to establish that we're arriving at the correct point. Some of it's not a science, I suppose. The other part is that different people have different views about thresholds, and that's why we need to review it to ensure and establish that we're applying the right thresholds. or what we believe are the appropriate thresholds, proportionate thresholds.
Any further points on item 3? Now we'll go on to item 4, child protection. Any points on that one? No. Item 5, children in care. Any points on that? No. So item 6, care leavers. Item 7, children missing from home or care. Jackie, please.
Yes, it says the number of children missing is 53, but what's the age limit? Is it from 12, mostly teenagers, or any younger?
Predominantly they're teenagers, yeah.
And how are they found? I mean, do they go somewhere that... they go missing, but I mean, is there some...
Yeah.
What does that mean when you go to find them? Is it police involved, or is it...
Police, yeah. Parents or the carers will ring the police and say, look, they've gone missing for a certain amount of hours, and then the police will try to find them. And sometimes the young person just turns up at home 4 hours later.
Sure. Okay, thank you.
Just to add to that, the categorisation of missing is a police categorisation, and it can be, as Deepak was saying, it can be for a matter of hours in terms of not arriving back at home at time, or it can be longer. So there's not one specific, I would say, response that covers all. It would be very varied.
Okay, thank you.
Okay, maybe I could just ask a question as well. The numbers of children missing from home in Q3 seem to be higher than they've been in the recent quarters. I just wonder if there's any trend there, any concern, or is it just natural fluctuations? Is there anything about this particular time of year? Again, it was Q3 last year, seemed to be about the highest in the previous years. So just wonder, is there anything behind that you know of?
There's no themes that we've kind of found from it, but like you said, it's that period when young people do kind of go missing for a period of time. Christmas.
Okay, so I think there is a bit of a Christmas effect, yeah. Okay. Andrew, please.
Yeah, my question is really sort of a follow-on to Jackie's question. The numbers of young people concerned with this issue, I would imagine, are sufficient to be able to detect or to identify any concerns related to particular groups. It might be by gender, it might be by age, which is one of the things which Jackie was mentioning. It might be by ethnicity. Now, I'm not necessarily suggesting, that that information be provided in part 1, of a meeting, but I think that it would be useful, if there were concerns, about particular groups, that is communicated in an appropriate way. So that was my first question or comment, really, a suggestion. And the second question is about the return home interviews with again numbers fluctuating, or percentage terms fluctuating quite considerably. I guess my concern there would be, I understand why it may be very difficult to conduct those interviews, but my concern, I guess, would be that the difficulty is possibly greatest amongst those children or young people who might be most vulnerable, most likely, to have additional needs, supports, and so forth going forward. So, I guess my question on that is, is this an issue to be concerned about, and is there anything that could help to explain why some quarters the return home interview figures have been higher than they have in other quarters? And is there anything which we could do to try to involve more, of the young people in that process?
Yeah, I just want to add to that is basically sometimes one child could go missing several times in that period, so that's probably why the figure looks higher. Did you hear me?
Yes, we can hear you.
Yeah. And I think that the question I think you're asking is in relation to the percentage of children that don't have the interview about how we address concerns around them. And I suppose it's the point that Deepak is raising, that these could be multiple, same child missing on different occasions. We get to see one occasion in terms of return interview, and it's difficult, I suppose, from this to arrive at to evidence that from this data, but it is an area that we do focus on in terms of establishing, wanting to review those and ensure that any risks are addressed.
But also some young people refuse to have an interview when they return home.
And what about the issue of perhaps disaggregating some of this data, not necessarily reporting it in part one of a meeting like this, but if there were any trends or particular cohorts that you're particularly concerned about, I think it would be very useful for us to know that.
I think if I understand what you're asking, it's in relation to dividing by age and gender to establish any patterns in terms of that aspect of it. I think the other bit we do look at is around where those young people may be found or discovered in terms of when they are missing, in terms of what the pull factor is or the push factor in relation to that period of missing. And also is covered later down in that this does include on the looked after cohort those children that are placed by other authorities in Wokingham area. So this is those children that live in Wokingham that may not be looked after by us as well. And obviously that's a number that we don't have control of as that grows or expands or shrinks.
Yeah, thanks. That's interesting. And I think what you're saying about pull factors is actually very interesting as well. And it would be useful if we could have perhaps a little bit of narrative at some point, about that. I imagine it's something which is quite dynamic as well, possibly.
Yeah. And I think you can have various factors like Deepak was saying around Christmas or the weather changing or spring or different things can influence that, because it can be those, as I say, it can be those that are missing for periods of time beyond when they're expected back that may be reported by a carer or a residential provision that then leads to the police categorising that young person as missing.
Okay, thank you. Any other points on item 7? No. So item 8, the Children's Services Workforce, any additional points on that? Andrew, please.
Yeah, it's a question about the agency staff and how they're deployed. And I guess my question is, are agency staff more likely to be deployed to work with particular cohorts of children? And I guess what I'm getting at, or is it simply where there is the need? I guess what I'm getting at there, is a potential concern, that if there was a cohort of children who had a experience of a higher rate, of turnover of social workers and so forth, they, in a sense, may end up being disadvantaged by having a larger number of social workers over any given period of time. So is it just that the agency staff go where there is the demand, or is there any evidence that they may be deployed, more likely to be deployed with particular groups of children? And if so, is that a concern?
I think to respond, I think you covered it partly in the question that we deploy agency workers where there's a need in terms of either a vacancy or sickness. And I would say rather than it being particular cohorts of children, because our children make a journey through our various different services or approaches that we offer. So you have the front door, you have the long-term teams that provide the child protection, child in need, then you have our looked after teams. And I would say anecdotally, our looked after team has probably the lowest number of locums or interims. I think it's possibly 1 or 0 at the moment, and then you could probably look at it that we do have some teams that are harder to recruit to, in terms of that may be linked to the challenging nature of the work, and I don't think that's not unique to Wokingham. That's I would say a national challenge, and I would say our front door teams is where we cannot hold a vacancy, and our because of the impact that will have then on the numbers you're seeing here, and what we would say around the safeguards that we have in place to ensure that we have the correct decision making and throughput. So we'd look very quickly to fill a vacancy if someone was off on sick leave for a period of time, in terms of plugging or covering that vacancy.
Okay, thank you. Any other questions on item 8? If not, then I think we're done on that particular paper. So just going back to the recommendation, where it's recommended that Children's Services performance indicators be noted. So I think we duly note those. Thank you very much for presenting the paper. The next item is the specialist accommodation, which is on page 27. Who is going to introduce that paper, please?
Good evening, everyone. That will be me. Those of you who know me, I'm Hayley. I manage the children's commissioning team at Wokingham, and I will present to you the paper on specialist accommodation. I have put together, so I'm assuming you've read and seen the report, and I've just pulled together some brief presentation slides to show to you, just to go through the paper, if that would be helpful.
Yes, I think briefly. I mean, assume that everybody's read the paper on the slides. Thanks for providing them in advance. So just briefly, please. Yeah.
So just to take you, so this paper, I pulled this together to basically provide an update around a work programme that myself and several other departments across the council have been working on in relation to increasing housing options and provision for children who are leaving care, and those who are 16 and 17-year-old within the borough who present as homeless. So the purpose of the report that I put in the pack today is around just providing you with that update, for you to note the programme of work that we're pulling together. So just some brief context. So we have a duty to accommodate, as a local authority, all homeless 16, 17-year-olds and care leavers who are 16 and older, under a range of different statutory legislations. And through the programme of work that we're looking at the moment, what we've determined is that the council doesn't have enough provision of their own in order to provide localised options for care leavers and young people. Now, what that doesn't mean is that we're not meeting our duties, because we can commission externally those housing options for our care leavers and young people. But what we want to do is actually provide our own accommodation, which is council housing, which is in borough and local for our care leavers. And it also gives us that opportunity to have more control over the accommodation that we're providing, be able to provide affordable rents, and to also quality assure better. So in order to improve or increase our provision and our local provision, a programme of work was pulled together. So there was 2 phases to this programme of work. The first one was around how do we increase our housing and support for care leavers specifically. So this is our care leavers aged 16 to 21. And the second was about our housing and support for our care leavers who were over the age of 18, and for our homeless 16 and 17-year-olds who present as homeless. So this slide, I won't go into detail, but it essentially sets out what our current provision is. So at the moment, we have a centrally located property in Wokingham, which provides accommodation for 16 to 25-year-olds. Some of them will be care leavers, and we have a range of accommodation at that property, which is self-contained flats or individual bedrooms that have ensuite facilities. That is very high quality provision for us within the local authority, but the issue we have is that we have a waiting list for that, and so we need to address that issue and provide more accommodation. So that's a piece of work that we've been doing for the last 2 years. So in 2017 we purchased a property, and actually in 2021 we renovated that, refurbished it, and now it is accommodation for our specific cohort of children who are care leavers aged 16 to 21. We've commissioned a support provider to provide the 24/7 support at that site, and it officially opened on the 14th of February, and occupation of that service is underway at the moment. To Saints, the provider, as I was saying earlier, we've commissioned them to provide accommodation-based support, and this is all about ensuring that young person has an effective transition from adulthood into independence. So the range of things that they will work with the young people and support them with is around ensuring they have a safe place to live, improving their physical, emotional, mental health of that young person, ensuring that they're prepared for future independent living, that they are able to budget, and that we're able to engage them and support them into education, training and employment. The actual housing itself, so this is the property that we renovated, is within central Wokingham. It provides 7 spaces for our young people. There are 4 ensuite bedrooms in the property, and 3 self-contained bedsits. And then there are some shared facilities in the property as well. We have a staff office on site. Staff are there 24/7, and we actually also have provision within the property to provide crash pad emergency accommodation for a young person if that is the need. And at the back of the property, we've also built a purpose-built training and meeting room, which is separate from the main building. And we use that as a multifunctioning space around training. It's a meeting room, but it also allows us to potentially operate a care leavers hub from that property. And as I said earlier, it officially opened on the 14th of February, and a number of care leavers have already moved in, and we're expecting that to be fully occupied in the next coming weeks. So that's our first kind of phase of the work programme that we looked at. But we also have a second phase, which is around looking at our housing and support for our care leavers who are 18 plus, but also the homeless 16, 17-year-olds in Borough. And so at the moment, we're at very, very early stages of this piece of work. So we've identified a potential site in Wokingham, and we're commissioning at the moment a number of feasibility sites to see what the potential and the opportunities are of that site. A business case is in development in order to ascertain what the needs and the exact requirements of that building. And we've got some capital money set aside to undertake renovations to that building to make it fit for purpose. We're currently drafting a timeline for that piece of work, but we're hoping, and subject to planning requirements and approval, that would be ready for occupation in the summer of 2023. So I think overall, in terms of those 2 programmes of work, it sets us in very good stead about ensuring that we as a local authority, and in our role as a corporate parent, are able to provide different ranges of accommodation for our young people and our care leavers within Borough, to make sure that we're supporting them effectively into their transition into adulthood. Any questions?
Thank you very much for your presentation. Got lots of hands here, so let me start with Morag. You haven't asked one yet.
Thank you. I think you mentioned that the work here was to address the waiting list. Is it possible to offer any predictions as to how close you can come to keeping on top of the waiting list, or is that really in the lap of the gods?
To a certain degree in the lap of the gods, but I guess what we're trying to achieve is making sure that we have accommodation that is local, that is affordable for our young people, and that we have more control over the quality aspects of it. And I guess for us, where a young person is on a waiting list, there may be opportunities for us to commission different accommodation. Sorry, it's the same accommodation, but it would be from an external private provider. We don't necessarily want to do that because we want to keep our carers, our care leavers local. So I think, it's to a certain degree we can predict it because we know our care leavers coming through who are aging out at 18. But what we can't predict is those 16, 17-year-olds who do approach us as homeless. What we are doing, though, is working with housing to look at better options for our young people. And there's a lot of work going on at the moment about how we better work with our colleagues across housing to ensure that we are avoiding, wherever possible, that homeless route for our young people, care leavers and our 16, 17-year-olds.
Oh, thank you.
Okay, Rebecca.
Thank you. I see that you have appointed 2 saints that are working south of London Road. We visited London Road and it's a fantastic facility. A few of us came down there, and I've driven past and can see people in there, and it's quite nice to see that it is actually up and functioning. So you've obviously got a contract with this service provider that's going to be working in there, and you talk about you're going to monitor it and quarterly. So how exactly are you going to do that? And also, if you've got issues with what's being provided, how are you going to deal with that? Thank you.
Yeah, so we, as you said, we have a contract with 2 saints, and as part of the procurement process, in order to identify that or award that contract to 2 saints, went through a competitive process, and there are a number of quality aspects that needed to be tested as part of that process. So I think we were very happy with the quality standards of that provider coming through, and they obviously won the contract. And more importantly, the actual determination of who was awarded that contract was decided by a panel of care leavers. So staff and council staff undertook quality checks to ensure they met our thresholds, but actually the young people were instrumental in choosing the kind of the provider that they wanted to deliver the support. And actually the young people on that panel, some of them are living in London Road, so that's very nice. In terms of the contract monitoring element, that's kind of our bread and butter in one way. We've got very experienced team who undertake contract monitoring, but we have a range of different things that we monitor the provider on. One is targets and another is outcomes. So in the first year of a contract, we don't necessarily have a baseline for what we expect, although we do set a range of different baselines. But I'd say the first kind of 6 months of the contract, we work very closely with the provider to understand how they're going to monitor things, what systems they've got in place. And that's some of the things that we also test as part of the procurement process. So one of the particular questions we ask them about is continuous improvement, monitoring and quality assurance and systems. So we would go in, and we are doing that at the moment with the provider, to understand how they're monitoring, how they're recording, and then with the provider and the team of commissioners, we will agree between us how we're going to agree how an outcome is met, and that will be from a range of different outputs and outcomes. So that will be quantitative data, but also qualitative. So we will have a range of case studies, we will do some audits on their case files, we will speak to the young people, we will talk to other partner agencies. So in the actual service specification with the provider, there are a range of different domains that we will be monitoring them on. And we have an annual report as part of that process. So I can share that with you. It's a document that I'm happy to share. But yes, there is rigorous monitoring as part of this contract. And then obviously every year, when we look at if we're going to continue that arrangement, if we're not happy with it, there are certain mechanisms that we can employ to ensure that we have enough oversight and governance of that contract. I think it's particularly useful to understand that 2 saints aren't a new provider to the council, and they've been performing very well in the contract that they have with our housing team. So we're pretty confident at the moment about the outcomes and the outputs that we will get from this provider in this service.
And just
thank
to
you
add,
for that detail. Sorry, there's a lot of detail there, but thank you.
If I can just add also that each young person there will have their own personal advisor that no doubt will be visiting them, and then that accommodation will probably be a rich source of feedback to any review that's undertaken as well.
Right, thank you. Prue?
Thank you. There's 2 different cohorts of people here. So there's the 16 and 17-year-olds who have lost their accommodation, and the care leavers. So obviously the care leavers we know about, we have a history with them, and we have all their details, and we know what's happened to them. The 16 and 17-year-olds who suddenly find themselves homeless, we're not in that position. How do 2 saints deal with not knowing about those people? Are there many of them in comparison to the number of care leavers, and do they come as a surprise to us? Are they known to us generally before?
So sorry, I may have confused you. So in phase 1, the housing project that has opened on the 14th of February, we've set that up. We've commissioned that to be a care leavers only accommodation. So it's for our 16 plus care leavers up to the age of 21. The second phase of housing that we were talking about in the presentation is looking at that 16, 17-year-old cohort. So that's a separate contractual arrangement to what is currently we're paying 2 Saints to deliver. So in relation to your question, yes, our 16, 17-year-olds are harder to predict because we may have 1 or 2 1 year, but we've seen an influx of that to maybe 5, over the last 6 months. So it can fluctuate. And it is hard to predict that number coming through. And that's why in the second phase of the programme of work, we are looking at doing something jointly with housing to ensure that when those young people approach our front door, we are in a good position to be able to offer them accommodation and support at that point. So, yes, it is hard to predict.
And just to add in on that, obviously the new property on the 14th of February, that those 16, 17-year-olds are looked after children, and then they obviously progress to become into the category of a care leave once they turn 18. So that cohort there are currently looked after or formerly looked after children.
I'm just wondering about the ones that we are not known to us. I mean, you haven't started on this yet, I understand, but is there a different way of handling them being looked at from their social care point of view? I mean, presumably they're going to need support, otherwise they wouldn't be homeless at the age of 16 or 17, but we may not have known about them before.
Yeah, so what I should say is that on the slide deck where it talks about current provision, so we have Reading Road who offers accommodation at the moment to, and they who 16 and 17-year-olds are eligible for that accommodation. So we do have provision for them. I guess we've just undertaken a huge piece of work with between Children's Services and Housing, which has developed a new process and a new joint assessment for those young people that come through our front door who are 16 or 17-year-olds as homeless. And that is a joint assessment that's undertaken by both teams. Both have to undertake a number of statutory assessments on that young person, and the determination of that assessment would outline what type of support or housing that young person needs or requires, and then as a result of that we would then arrange that or commission that type of accommodation.
Okay, thank you, that's what I was looking for. I think, yeah, I wasn't expressing myself very well, but yeah.
Jackie?
Yes, quite a few small questions really. You say 24/7 support. Does that mean there's somebody within the building all the time with them, or somebody just comes and goes?
No, so there's 24/7 staff support on site at all hours.
On site, okay. Yeah. And then you say, are they on benefit, these children? I mean, are they given money, or are they shown housekeeping really? How to budget? Does that come into all that?
So for those children who are under the age of 18, they will be a child, so they won't be in receipt of benefits, but they will obviously have their allowances through the social care, etc., etc.
Right.
But for those children, so a big component of why those young people are within that type of accommodation is because we want to ensure they have a successful transition to adulthood, and that follows a range of things. So the support that is on offer to those young people includes budgeting, finances, emotional well-being, support, physical health, employment, education. So there's an expectation that the provider is delivering that type of support or offering that type of support to that young person, but they're on top of that they're also offering training. So that's why we have an outbuilding on site to deliver those training courses which would focus on that.
Yes, that was kind of my next question, because there's got to be a gap during the day where they're not doing anything, but they are being focused to do something?
Yes, so them are in education, training, school, college.
And what about food? Sorry. What about, how do they get their food? Is there a kitchen? And they do it themselves?
Yes. So support staff are on site and they would assist them. That's one of their if their support need is around budgeting or cooking, we have a training kitchen in the back outbuilding, but we also have a shared kitchen, and then those who are in the bed sits have their own kitchen. So obviously place the young people in the most appropriate accommodation on site that will suit their needs. But yes,
good, thank you.
Okay,
thank you.
Can I just add that every child 16, 17 that's in there will be housed there will have a social worker. Each care leaver will have a personal advisor, and each one of those young people will have what's called a pathway plan, and that pathway plan will detail very much all those aspects that Hayley covered there, but that a lot of the focus of the work is the preparation for independence, that preparation for living. So it's around financing, self-care, cooking, all those sorts of aspects. And obviously another focus is on employment, education and training, because that's all part of that independence preparation.
Thank you.
Andrew.
Yes, thank you for your report and also for the very comprehensive answers to questions. It's much appreciated. A number of us had an opportunity to visit the most recently opened facility after building works were completed, and I think we all agreed, that it was a very, very high standard, high quality accommodation. It also has exceptional environmental, credentials as well. Now, when we visited the site, one of the ideas that was mooted, and I don't know if this was taken any further, but I think we were so interested in the possibilities of being able to get some personal feedback, from some of the residents, after they'd had a time, to settle in and say what they liked, what they found problematic, perhaps, about the new accommodation. Now, of course, it's their home, and you cannot impose on people in their own homes, and totally respect that. But you have mentioned that there is a lovely meeting room, on the site, and I'm just wondering whether that is still an idea, that could be considered. For perhaps a small number of people from this committee, perhaps corporate parenting board, to meet with some of the residents, just to interact with them and to see what they like, what they think could be perhaps improved, to help with other facilities going forward.
Definitely. So funny you should say that. We're just in discussions with Two Saints at the moment to say, to actually get that in motion and to kind of set that up. But what we've said is if they could have some discussions with the young people about what they would like to see out of it, and if they would be happy to have something on site at the property. But what we've also said is if people aren't comfortable with that element of people coming into their home, then we will find some mechanism to ensure that we hear the kind of the feedback from those young people and hear the voices, and because we're looking at obviously developing another site, it's really important to get that feedback from those young people to inform the next development. So yes, absolutely, we've spoken to the provider and they are very keen for us to do that. So they're talking to the young people in their upcoming house meetings. And if that's not a goer, then we'll find a way in which we can get that feedback.
If I can just add, Councillor Micro, I think that probably would be more appropriate as part of the corporate parenting board in terms of the activities that I know a range of councillors undertake where they have met with young people in their own accommodation and observed different meetings and so forth. I think that will probably fit in quite nicely into that schedule of activities that we've been doing. But just to add to Hayley's point, this has been a learning curve for us as well, and I think a key part of that learning curve for the next one, if we're able to develop the next one, will be the feedback from the young people that are there. That the early feedback has been incredibly positive in terms of the resources that they've moved into from those young people have moved in, but obviously that's very early feedback, and it will be important to, I suppose, hear that again as they've been there longer.
Thanks, Hayley and Adam, that's really good. Thank you.
Anne, please.
Thanks. I mean, just a very quick one. Is the property with the 2 bedsits and the 7 single rooms the same as the property with the 4 bedrooms with en suites and 3 self-contained bedsits?
Oh, now you've confused me. So what did I say? So the property in phase 1 has 4 ensuite double bedrooms, and it has 3 self-contained bed sits. Okay. Oh. Then, so if there is something about 2 and 4, then that will be a typo. The current provision that we have at Reading Road is 7 double bedroom en suites, and there's 2 bed sits, two self-contained flats in Reading Road.
So sorry, so there are 2 existing properties already?
No, so we have Reading Road, which was opened in 2018, and that's for our 16, 17-year-olds and our care leavers who are 18 plus. So that's nine placements there. Right. We know we need more of that, and for different cohorts within for our children in care and care leavers. So we've developed this phase 1 property, and I'm reticent to say the name because we try and protect the location of the property because there are children in care. That's why I keep referring to it as phase 1 property. So that opened in February, and that has 4 double bedrooms with en suites and 3 self-contained flats. And then the phase 2 accommodation we haven't determined yet.
Right.
So we now.
Sorry, under phase 1, you've got the property built opened in 2018, and the property that's been opened recently.
Yeah. So phase 1.
So 2 different properties.
Yes. So the 2018 property sits outside of phase 1 because that was undertaken a number of years ago. Only within the phase 1 is that property we've recently opened.
Right. Okay. Thanks very much. Yes, I was confused about that. Thank you.
Okay, thank you. Just wonder, in terms of location of these properties, do we find that locations fairly near the centre of Woking work best, or is there a need in Woodley or Finchampstead or Earley or anywhere else? Is it focused largely on Woking? Does that work best? What's your experience?
Yeah. Central Wokingham tends to work quite well. It's near to transport links, it's near to a town centre. It seems to be a preference for a lot of people, but it also has been the properties that we have managed to obtain have been in those locations. Yes, as we go forward and we look at further ones, we may look at other locations, but I think the feedback that we always have from our children in care and our care leavers is that they want to be in central Wokingham, not all of them, but near the transport links and near a town and near to Reading. That's what I would say would be our most desirable areas. Adam might have another view on that, but
I think the point you made around partly was also to do with the property that became available as well. And so some of that, but I would say transport links are a key element because it's a challenge for us with another resource we have that's not a residential resource, but another resource where young people visit, where transport is a challenge, and that is causing some challenges for our young people to visit that location.
Yeah, and we have looked at other properties before, and they've been ruled out because of the transport link. But also, Central Wokingham seems to work quite well in ensuring that that young person can maintain links quite easily with other services. So, for example, their social worker or mental health services or their doctors. It seems to be quite a good location in order to keep that network together quite easily.
Okay, thank you. Anne?
Haley, could I just mention that for young people in Woodley, I mean, there isn't a bus service to Wokingham. So I think for young people in Woodley, I don't know about Early. I don't think it will be really quite so convenient. Just to mention that. Thanks.
Thank you. I think we're done with questions. So thank you both very much indeed for your presentation, answering all those questions. And the recommendation for this one is that Children's Services Overview and Scrutiny Committee notes the report and supports the programme of work outlined below. I think we do that. Thank you very much.
Thank you.
The next item is item 46, which is harm outside the home strategy. A progress update. So who's taking us through this? Is that Matthew?
That would be, yes, that would be me, Chair. Okay. Thank you very much. If it's all right with you, Charles, share my screen and share an appendix that's been included with the papers in the report, as that might just help me cover kind of the key points in the report a little bit more quickly than going through the cover report itself. Is that okay?
Yes, that's fine. Thank you.
Great. Okay, I'll do that right now. Okay. Can everybody in the committee see that?
Yes, we can see it. Thank you.
That's great. Okay, so thank you very much to the committee for the opportunity to present on the progress so far with the harm outside the home strategy. The first thing I would say is this is a progress update. It's not a finished article. It's not the finished strategy itself. It's simply an overview of the work that we've been doing so far to develop this important piece of work. Very much in partnership with our strategic partners, particularly the police, members of the Community Safety Partnership, and various different services across the NHS, as well as children's services as well. So it's a big multi-agency partnership strategy. We're in the process of completing it, and at the end of the presentation, I'll show you some of the next steps that will take us through to completion of this piece of work. What we'd really like to do today is to share some of the work in progress so far, take some of your thoughts and your feedback on the way this is taking shape and things that you would like to see from the finished article. It's great to be back with this committee again. I have presented to you on a couple of occasions previously. Some of you might remember that. I think first I presented the SEND strategy for Wokingham to this committee, and then the children's services strategy immediately before Carol moved on from into her next position. And the reason I bring those two things up is because the SEND strategy, I think, is highly relevant to this piece of work for reasons that we will come on to in a second. And it very much falls within the framework of the children's services strategy as well. So it's great to be able to present this piece, which is on a specific theme that picks up on a lot of the issues that those other strategies start to set out. So I won't dwell too much on the contents page. I'll just leap into the actual purpose of the harm outside the home strategy, which is a bit of a strange title for a strategy. It's one that has gone backwards and forwards amongst the group of people who are actually putting it together. It started off as being called the extra familial harm strategy, but that was a little bit technical and technocratic for people. So it's actually now become the harm outside the home strategy. And the purpose of it really is to tackle several different issues that all relate to the risk of children, young people coming to harm outside the home environment. That harm could take the form of sexual exploitation, criminal exploitation as examples. It could take the form of children missing and or excluded from education. We were talking about this a second ago. Some of the issues around that in terms of the, I'd like to pick up on some of those questions and some of those issues that were talked about earlier, because I think this piece of work makes an important contribution, or should do, to tackling some of those. And the risks of a young person becoming either a victim and or a perpetrator of serious youth violence. Those are some of the kind of examples of the types of harm outside the home that this strategy is looking to address. And in terms of where some of that harm might actually take place, we're talking about various different contexts in which children, young people live their lives, including the online and the digital world, amongst their peer groups, within schools and places of learning, with and between neighbourhoods and borough boundaries, on or around public transport, and in the wider community settings in which children, young people live their lives. So that's really what we mean by harm outside the home and the type of contexts in which it might take place, that we're looking to use this strategy as an opportunity to tackle some of the issues associated with those things. Just by way of trying to summarise some of that, you can see on the right-hand side of this diagram, this strategy kind of exists in the middle of the intersection between exploitation of various types, extrafamilial harm, which is harm happening outside the home environment, and the issues around serious youth violence. And this really does give us a bit of a challenge, because even those stakeholders and partners that are looking to shape this piece of work and are very passionate about shaping this piece of work, even though they're very keen that we sufficiently address those three very complicated issues and the interrelationships between them, that does mean there's a lot of issues in scope for this strategy. And we have at various different points had a bit of a conundrum with the size of the scope of this strategy. You can start to see on the left-hand side of the screen the sheer volume of the numbers of issues that actually emerge from those 3 circles on the right-hand side and the intersections between them. So it is a real challenge to kind of keep this a focused piece of work and not a kind of let's prevent all possible bad things from happening to all possible children, young people everywhere under the sun type of piece of work, which wouldn't be a very, very focused strategy. So one of the things we are struggling with, but actually making some progress around, is keeping our focus on the most important things for Wokingham that relate to those issues on the right-hand side. We have had a huge number of inputs into this strategy so far, probably not surprising given the broad range of the scope that I've just set out for you on the previous slide. Suffice it to say, we've been gathering in reviews and reports, input from stakeholders, information about contextual drivers, including some of our key statutory duties. We obviously have statutory duties to protect children, young people from harm as it is. We also have statutory duties as leaders in the community safety agenda and leaders in the community safety partnership. We have new statutory duties coming online that relate to the duties to prevent serious youth violence. So there's a number of different core statutory drivers behind this particular strategy and this particular piece of work, which we are trying to incorporate and reflect. We also have a lot of information about social care practice, about multi-agency practice, practice in the health system, practice in education, which we're also trying to envelop into this, as well as a number of existing strategies and plans. There are obviously strategies and plans in place already that might tackle elements of this agenda. For example, they might tackle exploitation, or they might tackle education welfare, for example. What we're trying to do is just group some of those together and strategically align them so that we do the most that we can do to prevent harm outside the home. We've also been gathering in information about strategies in other boroughs and other areas and how have they tackled this particular agenda as well, to not reinvent the wheel and to learn from some best practice elsewhere. In terms of some of the things we already have in place, and this is a key thing I would stress to the committee, this is absolutely not starting from a blank slate. There's already some really excellent work and some excellent practice in the borough that helps to prevent harm outside the home for children and young people living and learning in the borough. There's a whole raft of work that the Community Safety Partnership do. There's the work of the Exploited and Missing Risk Assessment Conferences, also known as MRAC. There's a whole body of work growing around prevention of serious violence and exploitation. There's work that happens at the Pan-Berkshire level, which Wokingham is a very, very active and proactive partner in. And we have the work of our Prevention and Youth Justice Service. And all of that provides a huge number of strategic interventions to help prevent and reduce harm outside the home in the borough. And then we have operational interventions. We have the kind of early help that you heard about earlier. That has an important role to play in this agenda. We have our core work in terms of social work services and support. We have things like the KICS and Targeted KICS project, which is really through engaging through football and soccer, some young people who would otherwise be at risk of harm outside the home, that is both popular and successful. We have youth mentoring, positive pathways, the operational work of the Prevention Youth Justice Service. We've started to really do a bit of a trawl of the full sweep of impressive work that is already in place in Wokingham to tackle some of these issues and start looking at it for its effectiveness, start looking at it for where the gaps might be. Are we reaching all of the people we need to? Obviously, we will be applying all of that constructive challenge as we continue to develop the strategy, but it's important to note that we're not starting from scratch with this piece of work as well. Related to that is data and evidence, and we've done some very specific work to start gathering in all of that work. Now, this might be very, very small for colleagues on the screen, unless you have a 50-foot screen in the chamber. I'm sure you probably won't be able to read some of this. So let me just summarise for the purposes of this conversation. Some of this information you were looking at earlier, actually, in relation to the performance management update, including, for example, the children missing data, which will definitely form part of the evidence base behind this strategy. We would be concerned, obviously, about children missing education in the context of harm outside the home. We are interested in digging into some of the questions the committee was starting to float in its discussion a moment ago. So, for example, we are interested in disproportionality. We are interested in, are there any particular trends? We are interested in what's happening to girls in this agenda, what's happening to boys, because what we can see from the data so far is that it's not as simple as saying this is all about boys. There are actually issues that face young women and girls in this agenda as well. We will be digging into all of that kind of information, as well as the panel episodes, the recorded incidents that the police are recording, that schools are recording, that social care are recording. There's something called the Violence Reduction Unit, which is something that has been set up in partnership with the police as a bit of a Thames Valley initiative. They're doing strategic needs assessments across the Thames Valley. They're looking at hotspots in geographical locations, borough boundaries, all of the sort of geographical and place-based information that we'd want to see in relation to things like risks of becoming embroiled in gangs or dealing drugs or becoming victims of knife crime or perpetrators of knife crime. So there's some really useful multifaceted information that we're trying to draw together to make sense of in order to say which children and young people do we think are most at risk of harm outside the home, why, what are the issues going on, who does this particularly seem to be affecting, particular genders, particular backgrounds, particular age groups, for example, and what does that mean for what we need to focus on operationally and strategically going forward. As I say, this is work in progress. We're explaining the process really behind putting this work together. It's going to be something that's going to develop over the next couple of months in particular, but it's just useful to show you how we're approaching this now. And much like with the SEND strategy and much like with the children's strategy, we're very keen for this to have a strong data and evidence base behind it. That being said, there are some emerging priorities coming out from the strategy, which we'd also like to share with you. So first of which is that we should be focusing on prevention. One of the reasons for that is that the numbers in Wokingham are actually really quite small in absolute terms when we are looking at, for example, the numbers of children missing from education, or the numbers of children excluded, or the numbers of children who have for one reason or another been apprehended in possession of a weapon. The absolute numbers in Wokingham are really quite small, which is really good for Wokingham. If you look at Wokingham's position, for example, in the league tables, for want of a better way of putting it, around things like serious violence, it's really low on the list in the Thames Valley, very, very low indeed in terms of numbers of incidents, which is great for Wokingham comparable to other areas, but we need to keep it low. And therefore, partners are strongly of the view that prevention of harm outside the home should be a key primary focus of this particular strategy. That being said, where there are incidences of harm outside the home, we need to respond effectively and swiftly. We need to have the right response at the right time. We can't prevent all harm outside the home, so where it does occur, we need to have models in place that can intervene rapidly to minimise that harm and to try to put things right as quickly as possible. So that's an emerging second priority. And the third one that's coming out is the emphasis on partnership and multi-agency working, the opportunities to share information better, the opportunities to work more integrated and joined up way, share intelligence and share information about particular children, young people and families with a view to preventing, responding quickly is a huge area of focus. So even though we're still in development with this piece of work, we are minded to develop these three priorities as the priorities for the strategy. This slide I shall not read out in detail because it will take me probably all night to explain every single point on it. Hopefully you might have seen this featured in the report. You may have had a chance to look through the 10 key points that have emerged from the work that we've done so far, and I'd be very happy to discuss that with the committee and get into any of these particular issues in more detail. Suffice it to say, just to do a very headline tour, we are identifying particularly vulnerable children and young people within this strategy just from the work we've already done. That does include children and young people with SEND. It does include unaccompanied asylum seeking children. It does include, as we've said, those missing or excluded, young people in care or leaving care who are not in the education, employment and training we talked about a moment ago, and those children who are exposed to domestic abuse and conflict. Out of all the possible cohorts we've looked at so far, and we're still looking at data, we're still looking at information, we will go further into that. So far, those 5 categories are ones that are showing up as particularly vulnerable. They do cover all age groups, pretty much. They do cover both genders. And there is a lot of intersectionality between those groups as well. So a lot of the children, young people across each 5 categories are actually the same children, young people sometimes. So those who appear in multiple of those categories, we would regard to be multiply vulnerable in relation to harm outside the home. So a couple of other points to put on this. Things that have come out from conversations with professionals and some of the analysis so far, we need to make sure we're listening to families. We need to think about vulnerable parents, not just vulnerable children, young people. That is something that's come out. Information sharing always comes out in a piece of work like this one as something to strengthen and improve. There have been, unfortunately, some regrettable incidents where we know the right information did not reach the right agency at the right time. There have been cases where the police have known something that isn't shared sufficiently with education and or vice versa, and or with youth justice and social care. So we have to look at how we share information for the purposes of prevention and effective intervention. That is something we have to strengthen. We have to look after our frontline workers who are dealing with these sorts of issues. It can be very traumatizing for the professionals, is what I'm picking up as well. We need to make sure that we support them to tackle such difficult and challenging issues. There are some reasons to believe that tackling issues around borough boundaries is something we might want to look at. Wokingham obviously faces off to several other different authority areas, and it's not just the interface with Reading, although that's one that has had particular focus in some of our meetings so far. The reason why we might look at that in terms of harm outside the home is the more borough boundaries we're dealing with, the more capacity there is for breakdowns in information sharing, which could heighten the vulnerability of some children and young people. So how we deal with borough boundary incidents is one that we are going to continue to work up. I'm going to talk a little bit more about thresholds in a second, so I won't dwell on that too much. And we are engaged in a number of data sharing and intelligence sharing initiatives such as Thames Valley Together, we've listed here, and Better Together, which we will be using to improve the efficacy and timeliness of our information about vulnerable children and young people. But that's something that we definitely need to progress on from the feedback we've had from professionals so far. And then there was the final point here around meetings and panels and other sorts of decision-making environments where decisions and information are shared about vulnerable young people and children. We have to make sure that those meetings have clear remits, that the people who are coming to them understand what the meeting is about, that there's clear accountability outside of the meeting for action. And again, in most cases that is the case, but there have just been a few examples shared with me so far of where we need to strengthen on that in particular. So I've included in the report, and I shan't dwell on this, but I'll take comments and questions if there are any around it, about how Wokingham's model of what we're actually going to do, I think is quite unique, but based on some best practice. So there's best practice out there that says we need to take what's called a contextual safeguarding approach, which is about seeing the child in the multiple environments in which they live their lives and organise our services appropriately. And another best practice model, which is what's called the public health approach, which is frequently used to prevent and address serious youth violence, which is very much about taking a logical and evidence-based approach, stressing prevention, and taking action based on aligned and coordinated interventions, but with that very, very strong focus on early intervention and prevention with outcomes tested and evaluated. So Wokingham's model, emerging model in this strategy of what we're actually going to do is kind of a blend between contextual safeguarding and the public health approach. I'll go into that in more detail if the committee would like me to. Otherwise, I'll just keep powering through on this. We are looking at how we assess risk in the partnership operationally. Different agencies take slightly different approaches, but we have done some work, and again, across Berkshire, and I included some of this in the report for you, to bring agencies together to take common definitions and thresholds of risk, and getting on the same page about how we understand vulnerability, what we should be looking for, what are the warning signs, what should be the triggering of alarms for interventions, how does this all map on to what we actually then deploy by way of support, is a big topic of conversation and will definitely form some key input into the action plan behind the strategy. I've included in the report one of the other examples from elsewhere that we've been reviewing. This is from Barnet. They have a kind of approach to this which is about tackling vulnerable adolescents. They have something they use called their safeguard tool that looks at triggers and red flags around things like sexual health and behaviour, absence, familial abuse, emotional and physical condition of a particular young person, indication of gang activity, use of technology and sexual bullying, alcohol, drug misuse, receipt of unexplained gifts or money, and distrust of authority figures as categories that they use as professionals to assess the likelihood of risk of or experience of harm outside the home. So this is helping all of the professionals who are very much on the ground and at the front line, thinking, how does this become real for us? What should we be looking for? How should we be responding as professionals and as partners in a new way if we're going to strengthen our approach? So the strategy wants to draw out and tackle some of those issues. We are doing a lot of consultation and engagement at the moment. I would count this meeting as part of that consultation and engagement activity. It's always great to have members' input and steer at the formative stage of a strategy rather than after the event. So I would include that very much, this meeting, as part of that. We are talking regularly to the Community Safety Partnership, to the Children and Young People's Partnership. We are going to be consulting with children and young people themselves. I attach as Appendix 2, I think, to the report a plan of activities for engaging with young people on this piece of work, both whilst the strategy is being developed and then after the strategy is being implemented, because it's crucial to have their backing and support and input into something to make sure that we focus on the things that matter most to them. And there are other surveys and pieces of work that the Community Safety Partnership are commissioning, which we will also tap into in order to progress the work going forward. I'm nearly at the end, I promise, and then we'll be able to get into conversation and to questions. This diagram just simply shows how the work is being steered and how it's owned. This is actually being driven by the Community Safety Partnership, but it does have strong input from the Children and Young People's Partnership, and obviously matters hugely to Children's Services, which is one of the reasons why we have brought the piece of work to you today. And this is the last slide, which is our timeline and next steps. Obviously, I've said we are here at the time of writing because there's a bit of a long lead-in time for submission of these papers to the committee. We've moved now into that green block between March the 2nd and March 31st, which is about more stakeholder engagement, more data gathering and more analysis, which is what we're right up to our ears in at the moment, trying to make sense of the data, disaggregating, looking for trends, looking for patterns, all the while dealing with really quite small numbers of each incident, which makes that really, really challenging to do. But we're getting into it now, and our partners are very much supportive and behind us in that. So we will be progressing through those dates to a 19th of May completion, which is when we're taking it to the Community Safety Partnership. We'll be updating other groups prior to that. Obviously, this is a very key opportunity for us to get feedback from yourselves as well. But it's that 19th of May date that we're heading to for completion. So that is the last slide that I have, and I would be happy to take any questions, Chair, if that is appropriate.
Okay, thank you very much for your presentation. So Jackie, please.
Yes, thank you. It was a massive report, and it seems massive. And I hope I don't sound naive, but is it massive out there? Is it right? Because I used to be a magistrate and I was on adult criminal, but I was also on the family court, not youth. But I did go into 30 odd schools over a period of years giving talks on knife crime. And by and large, the schools weren't having too much problem, but we're talking 4 years ago. But I imagine it's escalated a huge amount.
So
not only knife crime, but all these problems and troubles that you're going to sort out.
Yes, well, we will hopefully help to address, I think, rather than sorting out. I think it is difficult to extrapolate a lot of trends in recent years for several reasons. One of which is COVID and the pandemic. So if we take, for example, exclusions and children missing from education, there's a lot of trends where that has gone down if you're looking at last few years worth of data, but not because we're doing a great job necessarily and that everything's fine. It's that the children were not in their normal place of learning and education to begin with. So we have to, in addition to the fact that we're always dealing with quite small numbers anyway in any of these categories, when we're looking for trends and patterns and directions of travel, it can be, something can have a 20% increase. There could be a 20% increase in children who have been found carrying weapons, for example, and you could be dealing with 2 kids or 3 kids. So it's difficult to draw some of those meaningful trends of what's really up and down, because it can come and go with ages and cohorts. What I would say is that when we talk to professionals, they're increasingly concerned about several things. So if you talk to head teachers, for example, they're increasingly concerned about young people aged 12 to 13, for example, who they're saying, in their own words, they're saying are in a much more adult environment than it was the case 5 years ago, than was the case 10 years ago. They're very concerned about cyberbullying. They're very concerned about the use of social media for sexual exploitation, sexual images. And this is a different thing from saying this is out of control in Wokingham, this is a terrible issue. I'm not quite saying that. What I am saying is that the professionals have a heightened level of concern around some of the issues that we've talked about over the course of this strategy update. What we need to do when looking at the data is determine where the real issues of concern are within that very big scope that we talked about before. And it might not be everything that we're worried about. It might be a small number of issues that we're concerned about and that we zone in on. One of the reasons I mentioned children, young people with SEND as a cohort that we might have some concerns around is because, again, back to one of the earlier items about the numbers of education, health and care plans, the amount of demand that there is for support for special educational needs and disabilities, the capacity of professionals to meet that demand. There are some children, young people for Woking where we know they have a number of vulnerabilities and additional needs and support requirements, who may be at greater risk of harm outside the home. So there are some issues that we want to dig in a little bit more into within the data just to get a sense of the Wokingham picture. But the professionals definitely have a heightened level of concern. That's not necessarily the same thing as saying that the issues are big and out of control in the borough, if that makes sense.
And another thing is, for instance, when people are misbehaving outside and there's knife crime and bullying outside, that can be seen, whereas online, the digital world can't be seen, can it? Unless somebody reports it. Yes. And I imagine that is not as rife. It's probably happening, but you can't get at it.
It's a very good point. It's a very good point. And one of the reasons why I think education professionals, the police and others are concerned about that is the lack of visibility. It's another reason why we're so keen to engage children and young people in this work, because we want them to share their lived experiences day to day and to feel safe enough to share that information with us so that we can draw out some of the stuff that has never been reported data, if you know what I mean. So that's another key part of that. But yeah, really good questions and reflects the complexity of this piece of work for Wokingham specifically.
Thank you.
Thank you.
Andrew?
Yes, thank you, Chair, and thank you, Matthew, for a very, very comprehensive report and also for your oral presentation. And thank you also for involving us this evening, as part of the consultation, the dialogue. I think this is very welcome practice for us to be able to have an opportunity to share with you this evening some of our thoughts and ideas. So thank you very much also for that.
No problem.
I believe that the draft strategy, has an enormous, amount to commend it, including the methodology that's been deployed and also the way in which it has been structured. I think you quite rightly have identified the challenge, the tension, behind getting something, that is comprehensive whilst keeping a focus, on key, key issues, the things that, in a sense, really matter, over which may have the greatest, greatest influence. I also appreciate, that you're clearly, not attempting to reinvent the wheel. There's plenty of originality, I think, in this report, but there's constant references, to best practice, to tools that are being used elsewhere. I was particularly interested in the example of Safeguard from Barnet, that you mentioned. And again, this is really, really good stuff. So thank you again, for that. I do have a couple of specific suggestions, ideas, that I'd just like to moot. There is a reference to the KICS program, for instance, but I may be mistaken, but it seems to me, that other than that, the voluntary sector does not seem to perhaps, get the recognition that it might be justified, in their strategy. So I'd be interested, on your thoughts on that. I understand, and if I've understood it correctly, the strategy covers 0 to 25. I hope that that is correct, because I think that that was again would be very, very commendable indeed. On page, I've got a couple of specific sort of suggestions. The focus on prevention, absolutely, understand, the importance in that. But I'm just wondering, this is on page 43, under point 1, the focus on prevention, whether it might be worth considering adding, not just tackling the underlying causes, not just the symptoms, but actually identifying them and really making it very explicit, because I think we often, sometimes it may be, may lead people to sort of assume, that we understand all of the causes. And I think it's always good to remind ourselves, that there's almost certainly, going to be other causes hidden away there, that perhaps haven't been revealed, sufficiently. The survey and the consultation process, I think, is excellent, and I was really pleased, to see the references. I think it's in Appendix 2 to how you're. I think you've already started from the 1st of March, engaging, with young people in primary schools and some of our care leavers and so forth. I think that is excellent, and again, to be commended. I'd like the. I don't like. I think it's important, there's a recognition given to the need to address the perpetrators of harm as well. But I'm just wondering whether or not that is given sufficient attention at this stage, in the draft strategy. So it's just a thought, okay? And I think that's probably it for the moment. Thank you very much.
That's great. So I'll respond. I'll come back on a few of those points. I've noted the ones that are suggestions purely, Councillor Mickleboth. Thank you very much for those. They're very helpful. In terms of those that were also suggestions and questions were kind of embedded within them, I would agree. I don't think that the input and reflection of the voluntary and community sector is sufficient at this stage of the work. I think that is something that we need to prioritise in this bit of the stakeholder engagement that we're doing for this one. We're lucky to have some excellent relationships with voluntary and community sector representatives who join the Children and Young People's Partnership, for example, and they're looking to represent the sector strategically for Wokingham. It will be our aim to engage with them and get their input, see which types of organisation need to be part of this consultation and additional analysis phase. They do obviously make a massive contribution to community life and to community settings for young people at a time when we've had to roll back in previous years on things like youth service provision. So it's incredibly important to get their input, and I think that steer from the committee and from yourself is welcome. It is a 0 to 25 strategy, you're absolutely right. That has been a bit more controversial than I'd expected it to be in the start of the process, simply because it reflects the multi-agency nature of the work. There are many areas within this where within children's services, for example, the focus is 0 to 18, and it makes it very difficult for those colleagues to make promises about what they can do for children older than 18, unless, for example, they have special educational needs and disabilities and so on. Whereas in the Community Safety Partnership, they're not really very age bound at all, but do see the value of focusing on 0 to 25. So we've I had to do a bit of a UN style negotiatory moment with people, and we ended up with a 0 to 25 focus, which personally I feel to be right. Absolutely agree on identifying those underlying causes. Absolutely right. Very, very tricky to do sometimes, and also depends on how far beneath the surface you want to call something as an underlying cause. So, for example, if your focus was just serious youth violence, for example, you might decide that an underlying cause is school exclusion. Because there is if you talk to the police, if you talk to schools or anybody, school exclusion, permanent exclusion from school is a huge risk factor predictor of risk of becoming a victim or a perpetrator of serious youth violence. But then one might also ask the question, well, what led to the school exclusion? So you have to go below that to find what the root cause of that might be. That could be undiagnosed special educational needs. It could be behavioural problems. It could be experiences of family difficulties at home where people are acting out in the classroom. So we have to be careful to not go through an endless rabbit warren of looking for answers, because otherwise we'll never draw conclusions. But at the same time, you're absolutely right. We need to try as best we can to identify those underlying causes and bring them to light and reflect them in our thresholds work and our understanding of the thresholds of risk and what professionals should be looking for out in the world as risks of harm outside the home. Thanks for the comment on the survey and the consultation process. We are passionately determined to get young people's voice into this piece of work, as again it's in the commitment in the children's services strategy as a whole that children are central to everything we do, and we want to put children's voice at the centre of that. So thank you for your feedback on that. I would also agree with you that the perpetrators hasn't been given sufficient attention within the current work that we've done so far in terms of perpetrators of youth violence, for example, or harm outside the home. We are doing more intensive work in coming weeks with our police colleagues, community safety colleagues and youth justice prevention, youth justice colleagues to ensure that we incorporate that side of the coin, if you like, much more into the current draft, and they're working very hard with us to be able to do that. I've got meetings with the police and their data analysts this week as well to ensure that we look at what is being used at the moment to identify the perpetrators and what interventions and work we might be doing with them that we need to reflect in the strategy. So would agree wholeheartedly that that's something that we need to throw a bit more of a focus on in the work as it develops.
Okay, thank you. So can we move on with other questions, you think, Andrew? Because we've taken rather a long time on this one. I think we need to other things. So Rebecca, please.
Just a brief question, and thank you. How are you engaging with schools? Because our young people spend so much time in school, and you know the head teachers, teaching assistants, they're the people that pick up on these things, and they are noticing it. So how are you engaging with them on how this strategy is going to work?
So one of the things that we're going to do to engage in that way is we've recently established, and some committee members might be aware of this or even part of it, the Borough Education Partnership that has been set up with representatives from primary and secondary schools in the borough. We're going to present the piece of work to that partnership and ask for the way that they would like to be included in the work going forward. We also have quite a few inroads through the work we do with special educational needs and disabilities. So a reference was made earlier, I think in the performance meeting, to the SEND IIP, which is the SEND Innovation and Improvement Programme, which we have running, which also has strong school and education input and involvement, and gives us strong networks into things like the SENCOs, the SEND coordinators, and some of the teachers on the ground. So we want to use all our available existing channels with schools to raise the profile of this particular work with them and ask them what is the best way for us to reach their frontline professionals who might have some really important insight to share with this piece of work. So we're going to be pulling the levers that we have to hand is the short answer.
Thank you.
Thank you.
Okay, proof. Thank you, and I do like a person who's enthusiastic about their work. Rebecca asked one of my questions. I've got a couple of other things. I really am interested in how much you're engaging with the young people, because I do think that's important, and how the Youth Council, for example, is engaged in this. So that's the first point. Second point is about whether online influences are within the scope of this, and I'm particularly thinking about those websites or Facebook pages which promote suicide or eating disorders or other sorts of things, self-harm, all those kind of things, whether that's within the scope. And the final point is actually to do with the question that Mr. Williams asked at the beginning of the meeting, except he wasn't here to ask it. So you've discussed briefly when you talked about this, split by gender and so on, and I'm wondering how you're going to tackle ethnicity in this, and I'm not sure what Mr. Williams is exactly getting at, which ethnicities he thinks are not being dealt with properly, but there's a clear implication that Children's Services is not, in his view, dealing properly with all ethnic groups. So I wondered whether there was anything you were going to do that was going to examine that side of it, I suppose, really.
Yeah, thank you for those questions. So in terms of the Youth Council, some of my colleagues in Children's Services have already started approaching the Youth Council on this particular subject to get their views on how they'd like to be engaged, and that conversation is still live. So rather than us just going straight to them and presenting the strategy as I have to this committee, which I'm sure would bore them to absolute tears, I want to work with people who actually engage with young people for a living to ask them what's the best way of getting into these subject matters. It's difficult because some of this stuff is really sensitive as well, and we must be responsible with the consultation that we carry out on this particular strategy when we engage young people in this. We might be asking them to come forward with information that they might not have shared with their own friends, peer groups or family, if we're asking them about what their experiences have and haven't been of, online cyberbullying or, some of the websites that you referred to, Councillor, in terms of encouraging self-harm or eating disorders or other things like that. They might themselves feel a little reticent to come forward with some of that information. So we're trying to work with people who do youth engagement and youth outreach to say, well, what needs to be an anonymous survey, what could be a focus group, what could be face-to-face, what would be much better done in sort of a group where people can answer anonymously live on certain portals. For example, we can do live surveys that are all anonymized, but that everyone who's taking part in the live survey on Teams gets to see the results as they're coming through. There's a whole mixed bag of approaches that we want to take with that. And again, we will be working with our colleagues in education to find out the best ways of framing the agenda for their particular school environment. Again, something else that makes this tricky is I'm not saying that schools in Wokingham have anything either to hide or that they want to hide in this, but I'm sure they would be apprehensive about handling this subject in an appropriate way as well. We certainly wouldn't want for people to feel that just because they were encouraging a discussion about a particular issue in a school, for example, that they were advertising as that school has a problem with this particular issue. Those two things are not necessarily the same thing. And that's a real tightrope for us to walk, frankly, as we actually take this work forward. So the answer is we're taking a many-pronged approach and taking a lead from young people themselves wherever we possibly can on that. Online influence is absolutely a subject matter for that kind of engagement and discussion. For the reason that was talked about earlier, what isn't reported we can't really see in terms of data and analysis. So we will be relying on things like national studies and research reports, but also the feedback from young people themselves about how big of a threat some of those online influences actually are, and what therefore we might need to do in order to tackle them as a council and as somebody who's trying to prevent harm outside the home. And then lastly, on ethnicity, this is going to be one of the key things that we look for as we go into the deeper analysis that we're doing towards the end of this month and the start of next. We want to see how the data is broken down. We can only really, or I can only really work with how it's recorded. So if people are recording that information, then we can do that analysis. If they're not, that might be something we have to flag as an action for the strategy to address. Again, I would also caveat one of the issues we have is the small numbers factor with Wokingham, which makes meaningful interpretation of trends and how big of a major issue is this by comparison to this more difficult than it might be if we were Milton Keynes, for example, or other areas in the Thames Valley that have stark, issues that they need to tackle in relation to this particular agenda. So I hope some of that was some sort of an answer to your questions, Councillor, but thanks for your contribution as always.
Okay, and finally, Anne, please.
Thank you. I mean, it's an extremely useful piece of work, I must say. I think I've got 3 questions. One is, under current strategic initiatives and approaches to harm outside the home, I mean, I think you've been touching on it really. It says there will be a specific partnership group that focuses on problem solving local issues such as direct engagement with young people and raising awareness of local activities. I just wonder, what sort of people would be doing this intervention work on the ground? You've gone.
I haven't gone. I'm here. Sorry, my camera is sometimes intermittent when others are speaking. So and then it comes back to life for some strange reason. Well, there's a number of different people doing these things on the ground in terms of those interventions. I mean, when we talked about things earlier, like early help and some of the core work that social workers do, they're obviously deeply embedded in this. There's people who run something called the Multi-Agency Safeguarding Hub. They're also very key involved. Teachers are key, certain healthcare professionals are key, and we're just trying to identify as many of those people very much on the front line of these issues as we can to get a sense of what is going on. It's an interesting piece of work because you realise that a lot of people's perspectives might differ. So coming to a common view of what the issues are and how to tackle them is part of the challenge of this particular piece of work. But it's one that we're making a lot of progress on, and we're using our community safety partnership and our children and young people's partnership to create that environment where we foster that collaboration.
Oh, all right. Thanks very much. That's very good. I was going to say, obviously, it must be useful to, as you were saying, sort of work with neighbouring authorities. But I would imagine that for some things, there could be links to London, couldn't there, for some?
Yes. So 2 things on that. We work very closely with our Berkshire West colleagues. So there's a Berkshire West Safeguarding Partnership, which we're very engaged with this work. So our colleagues in Reading and West Berkshire with us are actually all interested in this type of topic. We've all got some sort of strategy and development around it, and there's a lot of information sharing in that particular partnership. Helen is a very active member of that particular group, and they're looking to take forward a lot of learning from each other around that, which has 2 benefits. One is not reinventing the wheel. The other is addressing borough boundary issues that is common to Berkshire West. So that is really important for us to pick up. In terms of London or connections elsewhere, one of the agendas that we tackle through the police side is county lines and the running in and out of London for the purposes of things like child criminal exploitation, gangs, drug running, and some of the vulnerability that comes around that. How big of an issue that is for Wokingham is still TBC. It's something that but it's on the list of factors that we're working on to look at in terms of this strategy, yes.
All right, thank you. I've just got one more question, which is just trying to find. It's about the sharing of data.
Okay.
Yes, I mean, do you have Is it easy to share data? Because I mean, a lot of it must be quite personal and sensitive, or some of it must be quite personal and sensitive. I mean, do you get limits?
There is some really good information sharing practice across some of the established multi-agency groups and panels and hubs that have already got integrated working set up within them. There have been some examples shared with me by professionals where information sharing has fallen short in terms of predicting and responding to harm outside the home. A couple of examples shared with me relate to the sharing of information held by the police with a school and vice versa, and between a school and social care and vice versa. And so there's always scope for improvement in that particular area, but some really good things to build out from and to work from. And some of the data related projects that are going to be done, like Thames Valley Together and Better Together, are going to help facilitate that kind of data and information sharing that shows you very clearly geographically where certain issues are taking place, what type of issues they are, which will also help to bolster multi-agency problem solving or multi-agency working. So there are some gaps and we want to bring those to light, but at the same time there's some really good things to build on and some exciting projects ahead that will help.
Do you anonymise some of the data when you're sharing it?
Yes, some of it will be anonymised. All of the information that would be shared securely. So if it was down to the levels of individual identifiable children, young people, then the appropriate information sharing protocols would be used, and the right amount of anonymizing would be done in order to make sure that was shared securely. We again have to be a little bit careful with the small numbers factors, because in some cases, even though it's anonymized data, the numbers are so small the children might become identifiable accidentally. So we have to have an eye to this and do that in a responsible way. But that's something that the professionals concerned are it's well on their radar.
Right, okay, thanks very much.
Thank you, Councillor.
Okay, thank you very much, Matthew. I think we've all asked questions, so we'll move to the recommendation on page 35. I won't read it out, but to update us on progress, discuss and take feedback, and update the committee on the next steps, all of which I think we can note. And once again, thank you very much for your comprehensive set of slides, and we wish you well with developing the strategy. Thank you.
Much appreciated, Chair. Thank you.
So the next item is item 47 on page 69, which is the school performance indicators and Ofsted reports. Is that you, Gillian, that's going to introduce this item for us? Okay, thank you.
Okay, colleagues, I'm really conscious of the time, so I won't read through the report in detail. There are a couple of things that I think it's worth just teasing out and highlighting for you. The first area is around a change in practice for Ofsted from last September, and I think I've been alerting you to the fact that this change was coming. And this is the re-inspection of schools previously deemed to be outstanding. So those schools that were previously exempt from inspection have now been put back into the inspection cycle. And that started from last September and happened at the point of Ofsted actually resuming its full routine inspection of schools post its suspension during the pandemic. What does this mean for schools? Well, those schools that have not been inspected before might not have been inspected, particularly in the case of the borough, for up to 14 years. And the Chief Inspector of Schools, Amanda Spielman, is very clear to have a view that schools should be inspected at least once in the lifetime of a pupil's journey through that establishment. The purpose of inspection, she quotes, as being in order to inform parents to be able to make an informed choice about their child's education. So she wants those inspections to be recent and relevant and up to date. So those schools will fall back into the inspection framework and they will be inspected as part of routine inspection. However, there's a piece of work to be done in order to get those schools into the inspection routine, because obviously they can't just pick up the whole group of outstanding schools and inspect them inside of one academic year in terms of workload. So they've looked at the number of schools that were judged to be outstanding prior to 2015. And those will be the schools that will be prioritised in the first tranche of outstanding schools that will be inspected. Those schools who were inspected prior to their last inspection was prior to 2015 will receive a full Section 5 inspection, and that will be looking at the entire weight of judgments in the inspection framework, and would be an inspection that could change the judgment, i.e. the overall grading for that school at the end of the inspection process. Any schools that were inspected after 2015 would receive a Section 8 visit. That is a monitoring visit, and because it's called a monitoring visit and because of the way it works under the statutory regulations, it's not possible for that visit to change a school's grade. However, a Section 8 visit can recommend a Section 5 visit happens so that a grade change could be made within a fixed period of time after that Section 8 inspection. What does this mean in terms of schools who have previously been judged as outstanding? We do have a number of schools who fall into this category across the borough, and our schools community are very aspirational about how they would like to be regarded by Ofsted, and the outstanding inspection grade is prized by schools, and many schools are proud to have achieved that. The challenge for our schools that have already been judged to be outstanding, particularly those who were inspected a significant time ago, is the number of changes that the Ofsted framework has gone through in that intervening period of time. So a number of changes have been made. We know that each time the inspection framework is changed, expectations of schools' performance and what inspectors like to see ramps up a gear. So each one of those changes has heightened expectations and has changed some nuances around the way in which schools are expected to work. We would have an expectation that all of our outstanding schools would continue in that cycle of continuous improvement in order to keep up with the inspection framework. However, what we do notice is that there has been substantial change, particularly with the 2019 framework, around the expectations for outstanding. And I'd just like to kind of pause and highlight that in my conversation with HMI in December last year, HMI were very clear to point out that we should understand that the outstanding grade is now an exception to the rule, and that we should regard outstanding as exceptional in the truest sense of the word. And I've actually cut and pasted into the report for you a quote from the inspection criteria, so you can see the use of that word exceptional there. And the criteria that I've given you there for outstanding is the one around the quality of education. It is not possible now, the way in which the inspection framework is constructed, for a school to receive an outstanding judgment without this judgment being outstanding in its own right. And the anticipation in the inspection framework is that all 4 inspection judgments would be required to be outstanding in order for overall effectiveness judgment, i.e. the overall grade for a school, to be seen as outstanding overall. So in order to reach that outstanding judgment in terms of the quality of education, schools will now need to demonstrate that they meet every single criteria in the good category, and to meet that in an exceptional way. So there must be absolute clarity and consistency of teaching across every year group, every class, and every subject. And if that teaching is not consistent, then it can't be exceptional, and therefore the school cannot be judged to be outstanding. So I'm hoping you're getting a sense, colleagues, of the challenge that schools are facing in order to be judged as outstanding going forward, and that we maybe need to be recalibrating our view of where the outstanding judgment sits. And this is certainly the message that's coming forward from HMI, is that we need to be understanding that going forward, the outstanding judgment is very much an exceptional judgment, and is an exception rather than the rule. So that outstanding judgment, quite a change in terms of the inspection framework going forward. You'll see from the list of schools that we do have a number of schools that will be subject to those inspections, and we've got approaching into double figures a number of schools who will be receiving a full Section 5 inspection because of the length of time it has been since their last inspection. So I'll just preempt what I anticipate a question likely to come from the floor this evening, councillors, which would be around how are we supporting those schools and what are the kind of conversations that we've been having with those schools in the community. So this has been a conversation that's been ongoing over the last 12 months, where we've been looking at exactly those expectations, working in particular with that group of schools to help them understand those expectations and begin to plan for and understand how they might demonstrate those expectations and whether they are in a position to be able to demonstrate that they meet that criteria. One of the key things to really balance here for the school leaders is to make sure that they make the judgment call accurately, and that actually it will serve a school less effectively if it pushes itself forward with a self-assessment of outstanding when leaders are really clear in their heart of hearts that the school does not have that absolute consistency of quality of education, as I said earlier, across every class, every year group, every subject. It will actually play negatively into an inspection outcome if leaders assert that they do have that when they don't, because inspectors will be questioning leaders' efficacy of self-evaluation. So that's one of the conversations that we've been having, and a number of leaders are reviewing where they are self-evaluating their school currently, not least because we've had the curriculum changes that have come into play and a lot of work needing to be done in terms of implementing new curricula, and that curriculum needing to be in place in an exceptional way in order for schools in this moment to be able to demonstrate that they meet that outstanding criteria. So those conversations continue, and officers meeting with individual schools and having those conversations at an individual level, as well as some workshops having been run to support those school leaders. So if I just turn to the fact that inspections have returned, so we have a number of inspections that have happened since September, so during this reporting period, and you've got the links to the reports, and hopefully you've been able to access those reports and have a look at those reports. And you'll see that we are celebrating in particular some upward change of grades, particularly around Highwood Primary School and Radstock Primary School, both of whom are now judged to be good schools at their most recent Section 5 inspection. So really positive outcomes there, colleagues, to be celebrated. In terms of the school performance indicators, I think this is a conversation that we've been rehearsing during the pandemic since 2020, colleagues. We don't have a national data set for 2021. Just as in the same way as we didn't have a national data set for 2020. The last published data set is for 2019, and even Ofsted in their inspection work are using that rather out-of-date data now as the start point of any conversation with a school. And because, as you can appreciate, that data is quite historic, It's a very cursory discussion now around that 2019 data to say how close is that a reflection of the work that is currently happening in your establishment. So we don't have any comparative data for 2021 to be able to share and to look at in terms of, you know, graphs and things that we've been able to look at in the past together. However, we are anticipating that we will have some data in 2022. So results from qualifications will be published in for Key Stage 4 and Key Stage 5 in school and performance college performance tables. So we're anticipating that late autumn 22 and into early 23, we will have that usual performance data that we'll be able to bring to committee and to be able to discuss. In terms of Key Stage 1 and Key Stage 2, there will be assessments that will be undertaken, and that information will be reported individually to parents, but won't be collated into overall data that will be shared at a national level. So we will be in an interesting situation for Key Stage 2 data in particular, and thinking about how we will be using that going forward, because that will be available at an individual level. And you'll know, colleagues, that those tests have not been undertaken for the last 2 years in primary schools, but that information will now be available to primary schools themselves to look at. And primary schools will be asked to inform parents of each individual child's outcome. But we've yet to understand whether we will have any data that we would be able to look at a local level or at a national level. So very much around individual children's results being put together there. So it's a very quick summary of the report, colleagues. I'll pause there and take any questions.
Okay, thank you very much. Okay, Andrew.
Yes, thank you, Gillian. You mentioned the improved Ofsted ratings for 2 of our primary schools, including one in early. And I mention this because there was an enormous sense of pride within the local community and amongst the teaching staff at that school, and I'm sure at the other school as well. And the reason why I mention this is that equally you flagged up, what is potentially could become quite a significant problem. The potential for some schools that had been rated outstanding to be assessed at a lower rating. And some of the harshest critics, I'm afraid to say, are our parents. And I really do sympathise, with the teaching staff and others, who have to bear the brunt, of those feelings. Now, the question that I have, and you've outlined some of the practical measures, that you and your team are already doing with schools, to try to prepare them, as well as possible and realistically as possible, for what lays ahead. But the question that I have is a very specific question, and it's: are there any significant factors that can impact, on the Ofsted rate and an Ofsted rating, which, in many senses, is a snapshot, at a period in time? Are there any significant factors that cannot easily be controlled for? And the kind of thing that I'm, or that could be unexpected, and the kind of thing that I'm thinking of, is staff turnover. Loss of or changes in key personnel, within a school, and that kind of thing. And is there anything, if that is correct, if that's a correct example, are there any things that perhaps could be done, to try to help schools? address that kind of challenge as well.
Okay, thank you. I think that there's quite a lot tied up in what you've just said and asked there. So I'll try and walk through some of those things in sequence. I think firstly, I'm sure the schools community would really welcome the committee's acknowledgement of the real challenge that those schools who have that Ofsted grading currently as outstanding are facing going forward. And I think it is a challenge for the staff community, and it is a challenge for the leaders in those organisations to be able to work with the community in its widest sense in terms of helping everybody understand what these particular gradings now mean in terms of what's happening in school. And that's one of the discussions that we're having with these schools in particular, is around how they might position the conversation with their staff teams so that they are not demoralised because everybody's working really hard, and there are new curriculum plans to be put together and new teaching strategies to be implemented, and everybody's working hard on those. And it's not to decry that work, and also to help parent communities, as you say, Councillor, to understand what might be a change coming ahead, so that it's not a shock, and I mean a shock in the truest sense of the word, a jolt to the community in terms of the provision that's available in their school. So there is some positioning around that to be done. I think in terms of your question around, are there significant factors that can influence Ofsted ratings? I think there are some that can be planned for. And I think there are some that we are persistently alerting schools to being wise to. So firstly, the one that I alluded to in my exposition is around the fact that you really need to know yourself and be accurate in what you're saying about your own self-evaluation. And if you're not secure in a particular judgment area, don't pitch above it. Because that speaks to leadership and management not being really clear in understanding the performance of its organisation. So that's one significant factor. I think the importance of the quality of education judgment in this new framework cannot be underestimated. And I think that morally that feels right, and the profession thinks that feels right around if we're going to talk about quality of education and an inspection framework for schools, it should be talking about what's happening in the classroom and what difference that makes for children. And that's very much where that judgment is predicated. Some of the work to be done in there is around the curriculum changes that were due to come in 2019 alongside this inspection framework. We have had some transitional arrangements in place, and Ofsted have had in this inspection framework transitional arrangements through from September 19. Those have been expanded as we've persisted in the way in which we've been working during the pandemic. So Ofsted have recognised the impact that the pandemic has had on schools' abilities to be able to drive change whilst they've been managing the whole issue around the pandemic and some of the staff absences that you were hearing about, in item 1 around the performance indicators and the workforce. So that is being recognised by Ofsted, but the work around the curriculum, we now have our last extension to the transition arrangements in place. So that has just been extended. It was due to cease at the end of next week. And that's now been extended through to September. So schools have got another kind of breathing space to get their foundation subject areas. So that's the subjects of teaching that are beyond core subject areas of English and maths. They've got that breathing space to continue to make sure they've got the plan for the curriculum and the consistency in the teaching of the curriculum sorted for those curriculum areas by this September. So that is one of the things that, is a bit of good housekeeping that schools would need to have in place, and would have an impact on an Ofsted rating post this September if you hadn't concluded this work. I think another area that schools need to be particularly mindful of in the inspection framework is the continued focus on safeguarding and making sure that everything is absolutely tight in terms of housekeeping around safeguarding issues, the paperwork, processes, and the ethos of safeguarding within the school. So it's not just about the paperwork, it's about the way in which safeguarding is transacted in the organisation. So that is really important as well. I think in terms of your question around, are there things that can't be controlled like staff absence or staff turnover? I think those things can be mitigated in an inspection if you've got the business as usual work right in the first place. So if if you're missing senior leaders because they've left the organisation because you've done such a great job in growing them and you've got a great succession track record of growing future leaders, that's a real sales point. And what you're doing is, you're then growing the next tranche of leaders underneath to fill those gaps. That is something that is a real positive that you can lean into in an inspection framework. If it's because leadership isn't as strong or isn't as cognizant of some well-being issues and people are voting with their feet, then that's another issue. And Ofsted will notice that because staff well-being is one of the things that they do look at in the new inspection framework. So I think there are things that really ahead of time, a long time ahead of time, you can control. And there are things that, whilst you might have staff absences or, a whole group of children out on a trip, for example, you're still able to use their work and demonstrate how they are making progress across the curriculum without those children there. And I think I'd just finally add for information in terms of, are there things that are beyond the school's control? Ofsted have increased its focus on its deferral process for inspections currently. And we have had schools who've successfully deferred their inspection. So they've received a phone call saying, we're going to be with you tomorrow morning. And what the school have been able to say, particularly due to COVID, is that we've got X percentage of staff out. We've got this number of children out. We've got this many children receiving remote education. Things don't look like they would normally look like. You wouldn't see us at our best in terms of normal operations. And Ofsted are looking at each one of those deferrals, and actually the number of deferrals nationally has been quite significant. If you just think about the number of inspections that we've got on the list in the last 6 months, to have had 2 deferred, is quite a substantial number for us as a very small area. So Ofsted are recognising the additional pressures that are being placed by the pandemic as well.
Okay, thank you very much. Okay, Rebecca.
It's just very briefly on the Wokingham schools list. I'm not sure when it was updated, but there's some the status, the organisation, some of them aren't right. Might be worth looking at.
Okay.
So I know that some of the school, might be worth going through it.
I'll go back and have a check. Thank you, Rebecca.
Okay, thank you very much. Thank you, Gillian. Just move to the recommendation on page 69, which is to note the outcomes of the relevant Ofsted reports and understand implications of COVID-19 on reporting of results in from 2020 through to 2023. I think it was also useful to get the update on the inspections and what that might mean for our schools. We're going to have to all work with our local schools to help them get through that. I think it's the messaging has got to be key, I think, on that. So thank you very much, Gillian. So we'll move on to item 48, which is the forward programme, and it commences at page 77. So I think we know what we're doing tonight, hopefully, on 21st of March. On the June meeting, there's quite a lot of sort of school-related things there. I discussed the agenda, the forward programme with Helen a few days ago, with Helen and Lucy and Graham. I just wonder, Helen, if you have any update on anything for the June or later meetings, please, following that.
Thank you, Chair. I'm wondering whether the fostering transformation item could move to the corporate parenting board agenda or be deferred to a later meeting, and will be guided by the committee on that. It is a very substantial agenda for the 15th of June, and I suppose the other issue is whether we could cluster some items together under the heading of an education update, because there are several education items there. Thank you.
Yes, and there was one item came from the Overview and Scrutiny Management Committee last week, which was asking that this committee scrutinise the process for secondary school strategy, specifically about secondary school places. And the question was about in the south of the borough, so if that could link in with that as well. So I've got a couple of hands up here. Sorry, 3 hands up here. So Prue, please.
Thank you, Norman. I'm quite happy to have a sort of more general education update. I do think we do need to look at the secondary school strategy, but tonight we were supposed to have the resource-based units at schools item, which we haven't taken. It's on the forward plan in our list as the 4th item. We haven't had it, and I'm wondering whether we can wrap that in to a look at it so that we don't lose that altogether. Personally, I'm on the corporate parenting board. I would be happy to see the fostering transformation go there instead, but that might not be what the rest of the committee want, because not everybody's on corporate parenting board and they might want a say in that. But I do recognise that is a full meeting in June.
Rebecca?
Just wanted to echo what Prue said. I feel if we want to objectively look at these topics, and in June there's far too many. So we do need to look at moving something out of that agenda. It's far too long to be productive. So we need to put something somewhere. Where? I don't know. Maybe you can help, Norman, but maybe fostering is a good one too. We do have an update later on in November about fostering as well. So it does mean that the committee will get an update. So maybe that particular update could go to the corporate parenting board.
Okay, thank you. Anne?
Oh, yes, just to say, it's been mentioned that topic resource-based units at schools, obviously hasn't come up today. And I just wanted to say that I know it's considered as an issue in the south of the borough, but we do seem to have had a problem with spaces also in the north of the borough. So do you know when that topic might come up? Does anyone know?
Well, I think if we have a general education sort of update in June, then it could form part of that as to what the current situation is.
Oh, okay, thank you. I haven't finished. The other thing, it's just a minor point actually. It's just that the date of the next meeting, 4th of January 2022, must be the wrong year, and the next meeting as well.
Yes, it must be.
Right, thank you.
Andrew.
Yes, thank you. Yeah, I too would be happy if the fostering transformation item was to go to corporate parenting board, but I have to declare an interest. I am a member of that board, and it may be that some other people here tonight who are not, would prefer to keep it, the view and scrutiny. I would also support the idea of a sort of a composite general education update. One item, and I hesitate to suggest an additional item within that that general update, but I'm wondering whether, depending on the numbers of Ukrainian residents who we welcome to our borough, whether it will be necessary, appropriate, to get some sort of feedback as to what sort of provision and issues may be facing those young people. I might also include possibly some of our recent arrivals from Hong Kong as well, because my understanding is that there may well be a further significant wave of new arrivals from with families, from Hong Kong to our borough soon. So I think the decision on whether or not to have a specific sort of item within that general sort of report could be left closer to the time, depending on numbers and what sort of issues arise. But should it be necessary, I think it would be very, very important, that it's acknowledged and discussed. Thank you.
Okay, so there seems to be general agreement to move the fostering transformation item to the corporate parenting board, and then we will have a sort of an update perhaps in November, so it will come back, but at a later date. And there seemed also to be support for an education update in June with these items brought into it that we've been discussing. Does that seem sensible, Helen, from your point of view?
Yes, thank you, Chair, and to the whole committee. That seems very pragmatic.
Okay, great. Thanks. Any other points on the forward programme at this stage? No. Thanks. Okay, no other points on that, so we'll move on the agenda then. So I'll have to read the statement in the agenda, item 49, which is exclusion of the public, that under section 100A brackets 4 of the Local Government Act 1972, the public be excluded from the meeting for the following items of business on the grounds that they involve the likely disclosure of exempt information as defined in paragraph 3 of part 1 of schedule 12A of the Act, brackets as amended, close brackets, as appropriate.